Hi, good morning, everyone. James Fuccione from the Massachusetts Healthy Aging Collaborative. We are absolutely thrilled this morning to kick off the Caring for Those Who Care webinar series in partnership with the Diverse Elders Coalition. We have Jackie Boyd and Nina Darby here from Diverse Elders Coalition. They will be introducing themselves and the organization and the great work and research they have done and that they'll be presenting. So this presentation is going to be an overview and sort of context setting for what will follow, which will be 6 one-hour training sessions focused on different populations. And I'm going to put in the chat, and we will also share the link to where you can register for these upcoming trainings. So we'll start with next week on June 24th from 11 to noon time. In recognition of Pride Month, will be a focus training for LGBT caregivers and older adults. And so what we'll say is that the trainings will not be recorded, but today's session will be recorded. So you'll be able to have this overview thanks to Jackie and Nina and their organization, so that we can promote this great work and help get people connected to this awareness and this education. So joined today by the Equity and Aging co-leaders. And so Antron and Samantha, if you could introduce yourself. Antron, you can go ahead.
Hey, thank you for having me. I'm Antron Watson with AARP Massachusetts, and I work with the livable communities here in Mass, and we're looking forward to the presentation today. Thank you.
Thank you. And Samantha?
Hi, everyone. I'm Samantha Hamilton. I'm the Live Well Springfield Program Coordinator under the Public Health Institute of Western Mass. Part of this collaborative effort to bring forth equity and understanding of diversity in our community. Excited to have Jackie and Nina here. When we first heard about their presentation, we thought it was a great project. James brought it to us to bring forward to the community, because we think of diversity in so many ways, and this is a great perspective to have. Excited to do age-friendly work in Springfield. Springfield is the first age-friendly, dementia-friendly, and age-friendly hospital system community, and looking forward to continuing that work. And I'm happy to be here.
All right, thank you both. So I'm now going to get out of the way and let Jackie and Nina take over here and give this great presentation. And Jackie, you can talk about how you're welcoming participation via chat. So that is opened up for folks if you have questions or comments along the way. But thank you for being here, and we look forward to the 6 following trainings. So with that, I'm going to introduce Jackie and Nina. Thank you so much.
Thank you so much to the team behind the scenes. We appreciate you. I am Jackie Boyd. My pronouns are she, her, they, them. And it is such a pleasure to be with you, Massachusetts. Happy Pride. I hope you all are doing well today and are excited to learn and share some of your experiences. I'm going to share my screen in a moment here, but would love for you to put in the chat a bit about yourself. Who are you? Where do you work? What kind of work do you do? We want to be sure that not just this training, but the 6 to follow is really tailored to who's in the room and what your needs are. I have the honor and privilege of being a caregiver for over 20 years. And I own a care management company in Chicago that centers the needs of Black and Brown and LGBTQ plus communities. So for me, it has been a great honor to work with the Diverse Elders Coalition. The DEC created this curriculum to help identify and address the unique needs and caregiving realities of family caregivers. And when we talk about diverse communities, we're talking specifically in this context about caregivers from American Indian and Alaska Native communities, Asian American and Southeast Asian American communities, Black and Latinx communities, and LGBTQ plus communities. So if you are a caregiver, if you are a service provider that represents these communities, we really want to hear your voice today. So please don't hesitate to share your stories, your experiences, and your best practices in the chat as we go along. Our hope is that together we will all gain a deeper understanding of how culture and language impact family caregiver perceptions and health outcomes. And we want to help develop your cultural competency. As anybody who's been in social services or the helping professions know, we learn something new every single day. So that saying that cultural competency is a journey rings particularly true when we're talking about the breadth of these diverse communities. So I invite you all again to put your information in the chat. Would love to hear what's on your mind so that we can answer any questions that you may have and tailor our comments today. So the Diverse Elders Coalition has been around since 2010, and their focus has been to represent the communities that I just mentioned. This is deeply personal work for the Diverse Elders Coalition and for myself as a trainer, and I know for Nina, because what the Diverse Elders Coalition does is it uplifts and amplifies the voices of diverse elders and the caregivers they serve. And they advocate for policies and programs on a national level. I'm going to take a pause there because I want Nina and I to be able to share a little bit about why we are fans of the Diverse Elders Coalition and how you can use them as a resource even beyond this training. So for myself, as I said, I focus on 3 out of these 6 communities, and there are almost no resources in the aging landscape in general that's talking about what's happening for gay, trans, bisexual elders, what's happening for African American and Black elders and Latinx folks. And so early on, found Diverse Elders Coalition, and even just the website is a wealth of information because our communities need more support, need systems to recognize what's happening every day and how diverse family caregivers are often shouldering a heavier burden than their counterparts. And it's time for our systems to adapt and change to meet those needs. Nina, do you want to share a little bit about your story? Because Nina's going to be your presenter for the remaining 6 webinars.
Sure. Thank you so much, Jackie. Good morning, everyone. I'm so happy to be with you all. I'm especially happy because I'm in Massachusetts. So I'm in West Newton right now. I've spent the last 10 years working in Boston. Shout out to Boston Senior Home Care folks who are here. I recently worked there as a training manager, and it's wonderful to be with folks in Massachusetts in the ASAP network and in the aging field. So thank you. I am so honored to have joined Diverse Elders Coalition a few weeks ago. But what brings me to this work personally is that my mother was a caregiver to my grandmother. And my mom really stepped up out of love, but didn't know the immense responsibility and undertaking of caregiving. And it was tremendously difficult for her until she got supports. And my Grammy lived to 98 years old. We were so fortunate to have this incredible, aging and home experience with my grandmother. My mom and my grandmother don't fall in the diverse communities that Jackie's going to call and really center today. And so I recognize that any caregiver may struggle in their role, but I'm excited to be here because particularly for folks with diverse identities, there's unique challenges that they're experiencing that are really important for us to center because their experiences are different and we really need to hear their voices. So I'm thrilled to be with you all. I'm excited to rejoin you next week, and I'm going to pass it back to Jackie.
Thank you so much, Nina. And I love hearing what everybody's up to in the chats. Thank you so much for sharing a bit about your work, who you are, and I see that there's some resources that could be really helpful for your further learning. I saw that one of you is a LGBT runs an LGBT virtual senior center online, which sounds like a wonderful resource. So keep that information coming. We want to know what you're up to as well. So I mentioned these 6 communities. It was important for us as we brought this training to life to recognize it would be impossible to cover the breadth of diversity that we may be thinking when we talk about diverse older adults. So when we talk about diverse older adults in this training, we are specifically speaking to these 6 communities. And these are the organizations that make up the Diverse Elders Coalition. They have done a phenomenal job of contributing to this curriculum and contributing in a meaningful and significant way to the research that was done that forms the basis of this curriculum. So NAPCA, the National Asian Pacific Center on Aging, the National Caucus and Center on Black Aging, the National Hispanic Council on Aging, the National Indian Council on Aging, SAGE, and the Southeast Asia Resource Action Center are all leaders in this field and organizations that I would encourage you to follow up with if you're looking for more supports or training at your organization. So I think it's really important always to discuss the strengths and to start from a strengths-based approach, because often in these kinds of courses we're talking about the disparities, and don't worry, we'll get to the gaps and to the disparities here too. But you know, in my career as a care manager, I have just been overwhelmed by the resiliency, the creativity, and just the deep commitment that diverse caregivers have to their loved ones. And much of that comes from a culture of care, from this feeling that we will support our loved ones. We don't want them to be in homes. We don't necessarily trust outside providers. We want to provide that care in the family. And I have a client who I actually just worked with last Friday. Her sister had had a stroke. They're Latina. Her sister was 55 and had a stroke, and it was devastating. And this woman has just turned her life upside down to try and support her sister, from showing up at the rehab facility every day to fighting with Medicaid to make sure that her needs were met, to then ushering her to an acute rehab setting to see how her sister could recover, to now at 60, I think she's 63 years old, this caregiver is, she moved her sister into her home. So she brought her sister home, her sister who is still in a wheelchair, still having challenges around mobility, and she's really the only caregiver. And she's still working a full-time job. So I just think it's so important to recognize the strengths that these communities have in valuing and actively caring for the older adults in their lives, balancing all those different priorities, having to be really savvy around finances and systems, and making sure that they are living into the legacy of their cultures. And each group does it a little bit differently. So we're excited to share some of the ways that you can support diverse family caregivers. I'm going to talk in a minute about the way that this curriculum came together and the research, and we'll spend a little more time on research in this webinar than we will in the other ones, because the research is what basically provided the foundation for all of the other modules. So hang in there with me. If you're not a research person, I promise that there will be something interesting in here for you, and we will also share some high level best practices. It's important to know that some of the themes that came out of the research was that the challenges diverse family caregivers are having are there's just a lack of research about their needs. And so there's not funding for their programs, and there's not an awareness of policies that would improve their lives. By and large, people are dealing with limited financial resources. And when I think as a care manager, how important those financial resources are to feeling like you have quality care, right? In Illinois right now, a shared room in a nursing home is $92,000 a year. And if you have 400 nursing homes to choose from, how do you make those choices? How do you navigate that? If you have a parent who is English is maybe their second or third language, how do you find out of those 400 a place that will accept Medicaid if they're dealing with a lack of financial resources and has staff and other residents that speak their first language. These are issues that, again, I've seen over and over again, and a lack of resources to support the intersections that diverse family caregivers live at. Many diverse family caregivers are dealing with social isolation and loneliness while caregiving and need time and tools for self care. And the first bullet point, which I've already alluded to, and having been in aging services forever, there really is a lack of culturally competent resources and services. So I am personally grateful that each of you are here today to learn and to share your experiences because we can do better. And as a system of support, we need to do better. The key takeaways from our time today are that it's important not to paint these communities with broad strokes. Family caregivers have varied racial and ethnic identities, sexual orientations, and gender identities. They're providing a range of supports for their loved ones, and they may not identify as a caregiver. This is really important because I know in your outreach, you're probably using that term caregiver pretty extensively. But for example, in LGBTQ communities, because there's not the family of origin relationship, oftentimes people who are doing caregiving identify as friends or as chosen family. So they have other language that's used to describe themselves and their relationship to the care recipient. In many other cultures and other languages, people don't describe their relationship as a word. They talk about what they do. So they'll say, I am a helper for my mom. I help or assist my grandparent. So again, language is really important when we're thinking about supporting diverse family caregivers. And for us in aging services, it requires us to get creative and to continue our cultural competency learning. Many diverse family caregivers have a strong cultural commitment to caring, right? And this is really important because our systems don't always offer a lot of nuance or a lot of room for creativity. So I'll give you an example. If we think about HIPAA, right, and protecting people's health privacy information, if you have a loved one who is in the hospital and there's supposed to be one person, right, that power of attorney for health that is the only person that can make decisions, that doesn't work for many Latinx, Asian American, Southeast Asian American family systems because typically decisions are made collectively and everybody's showing up to try and support. So even some of our most basic ways that we're trying to protect people can get in the way and be a roadblock for diverse family caregivers. Other key takeaways, it's important to understand the different cultures and identities of the caregivers you serve because you can have an impact on their health, right? You're going to see the numbers in a minute, but essentially it makes sense if we have caregivers that are doing more with less, don't have the financial resources they need, are feeling lonely or isolated, and their culture isn't reflected in the services that are being provided to them, that's going to have an impact on your quality of life, on your health, how you feel, and the quality of care you provide. Luckily, there are concrete steps we can take. So we are always working to improve our services in the helping professions, and we hope to give you some practical, concrete resources today to further your learning. The research and the curriculum that you are enjoying today is generously supported by the John A. Hartford Foundation. They provided a grant to the Diverse Elders Coalition to analyze the existing research, to generate original research, and to develop policy and programmatic solutions to meet the needs of diverse family caregivers. So you can see those goals here more clearly articulated. The starting place for the Diverse Elders was harnessing, for the Diverse Elders Coalition was harnessing their network. So the Diverse Elders Coalition is made up of those 6 organizations we talked about. and they have 93 affiliates around the country. So the research that forms the basis for this training comes from rural areas, urban areas, north, south, east, west, and my homeland, the heartland. There were 18 stakeholder interviews. There were over 1,000 survey respondents, 36 focus groups that happen in 8 different languages. I'm gonna let that sit for a minute because oftentimes we think, oh, it's gonna be harder, it's gonna be difficult to be inclusive. You can absolutely do it. And if we are supporting folks at the margins, we're doing a better job for everybody. So thinking about how can you provide in-language resources. The Diverse Elders has done it, you can do it too. And engagement with diverse family caregivers at multiple points throughout the training curriculum development. That's what's really important. I think about care and organizational wellness from a trauma-informed lens. So I'm always thinking about how can I collaborate with my clients? How can I collaborate with these community partners? So that's how you can think about generating your own research or creating your own new programs. It shouldn't be a silo. It should be in relationship with the communities you're trying to serve. It's important to remember that our nation is growing older and diversifying every day. Sometimes I think about this work also from the place of being an employer and how to be an employer of choice, because you see these changes happening very quickly for younger folks. For example, with LGBTQ plus communities, the language and the culture that my older adult clients, folks who are baby boomers and above, experience is very different than the 25-year-olds that work for me or the folks in their 30s and 40s. Those cultural experiences are different. The language is different. What feels like an affirming work environment is different. So, whether you're thinking about this for clients that you're serving or internally, how to improve your internal operations, having this lens on diverse family caregivers can help you have a more equitable and inclusive business. Currently, 1 in 5 elders in the US is a person of color or American Indian Alaska Native, and by 2040, it will be 1 out of 3. 3 out of every 8 LGBT adults are elders. And this is really important because, and I'm going to come off the presentation for a minute. This is really important because again, when I started in aging services, I didn't see LGBT elders. There was no rainbow flags or rainbow stickers. I rarely saw or had the chance to work with LGBT older adults. And as I learned more, I realized LGBT older adults, when we say older adults for lesbian, gay, bisexual, transgender folks, we are talking about people 50 and up because at age 50, 41% of lesbian, gay, and bisexual elders have a disability. 41%. It's 27% for non LGBTQ folks. And for transgender folks at age 50, 65% of them have a disability. So if we in aging services don't know these communities and don't understand their health journeys, we are completely missing the boat. So for that 50-year-old transgender person who is seeking senior housing, they don't even qualify on the basis of age, but they're the ones that need it. So I'm going to pause there and see, Nina, is there anything that you want to chime in on? And folks, if you have questions or your own experiences that you want to put in the chat, we want to hear from you.
Thank you so much, Jackie. As you can tell, we're just really proud and honored to share this materials. And it, like Jackie said, it's really possible to center the voices and the diverse voices. It's really possible to be inclusive. And so today is an overview of the Caregiving Initiative, this incredible research that Jackie's sharing with you. And then next week, as Jackie shared, I'll be doing a deep dive into each of our diverse communities, starting with LGBT older adults and caregivers next week. So thank you for sticking with the research. It's a pretty expansive and incredible process, but through the research, we got to hear the voices that we want to hear from most, and that is what is involved in our curriculum that we'll get more into next week. So thank you. I'll pass it back to you, Jackie.
Thank you, Nina. So when the Diverse Elders Coalition was putting out their information, this is who responded. So the caregivers who responded to the survey, 72% were female, 48% were married. The average age of the caregivers who responded was 54. So keep in mind that average means obviously there's folks that were much younger and there's folks that are much older providing direct caregiving services for someone in their life. 56% were born in the US, 47% live with their care recipient, and 43% are believe they're the only person who can provide care. I talked a little bit about culture and the strength that diverse family caregivers bring to the space of aging and care. Culture as a reason for caregiving really stood out from the survey. People said that cultural obligation is a reason they provide care for a relative or friend, right? So whether that is filial piety, which you'll learn about in Asian and Southeast Asian American communities, familism, which you'll learn about for Latinx and African American communities, there is deep cultural roots to providing care for many of these groups that we're talking about. The exception is LGBTQ plus caregivers. They report less of a cultural commitment, which makes sense, to caregiving than the other groups. And American Indian and Alaska Native caregivers reported the highest alignment with cultural commitment to caregiving. And there's a great video that we will watch in one of the coming weeks because we don't quite have time for that today. Some of the interesting differences that came out were that caregivers who were born in the US that responded to the survey were younger, had higher incomes, higher educational degrees, and assisted care recipients with more health-related tasks but fewer cultural tasks. They reported higher levels of relationship strain, that the relationship with their loved one was strained more than their counterparts who were not born in the US, and rated their relatives' healthcare as being of lower quality. Caregivers who were not born in the US were likely to be older, lower income, fewer educational degrees, assisted care recipients who use less professional services or paid help, and were less likely to report they provided care because it was more convenient for them to fill this role than other family members or friends. This, I think, is a really key concept for us to understand, that assistance with cultural tasks relates to health outcomes for caregivers. So you'll want to look on the right-hand side of the screen. When we say cultural tasks, those are things like translation, navigating immigration, trying to communicate and interpret at the doctor's office, the hospital, with housing authorities, when trying to get home health or hospice. Almost every system is more challenging when you have a care recipient who is not able to understand English fully or understand the way that we are communicating. So sometimes I'll talk about in our systems medicalese, right? That we will have a lot of big fancy words that that even people who are English first language struggle with. So imagine what that's like for that caregiver and that loved one who's trying to understand, what is my condition? What are these medications and what are they going to do to me? Where can I get help and support? So, keeping in mind that cultural tasks, such as translation, are resulting in caregivers having four different types of strain and higher levels of depression. They are experiencing isolation, strain on their own health, strain in their relationship, and strain at work. So, this is really important because, again, if you have a community around you that you're trying to serve and you don't have um, forms and information at about a fifth grade reading level available, that's what's recommended for working with people who are limited English proficiency, is to have your forms, your documents, and be able to communicate in accessible language at about a fifth grade reading level. If you don't have that, then people are not necessarily getting their needs met, and it can impact health outcomes for the care recipient and for the caregiver. Some of the challenges to be aware of are that Asian American caregivers were found to have more limited knowledge of symptoms, treatments, and diagnoses of Alzheimer's and related dementias. American Indian and Alaska Native caregivers report distrust of majority culture and are hesitant to utilize healthcare services. In Hispanic and African American caregiving communities, they reported being ignored and excluded from conversations about care they provide, receiving little or no formalized training on home care tasks, confusion about medication management, and discrimination and stereotyping by healthcare professionals. Caregivers who identify as a gender and or sexual minority also report experiencing this discrimination. And because I'm a brass tacks person, I'm gonna put it to you in more common language. There is systemic bias and racism that impacts people's health outcomes. I see this every day with the clients that we serve. I see the way that my older African American 91-year-old client who doesn't have family laying in that bed in the ER is treated differently than my younger Caucasian male client who people pay attention to in a different way. I see it when I walk into a room in the way that ageism shows up, and that I, as a younger person, am spoken to first versus my client who has gray hair and appears less able bodied. There are all different kinds of bias, and diverse family caregivers are at the intersections of this bias. And we have a unique moment right now where we are reckoning with racism in this country. And for me, it's as a provider, it's really an opportunity to learn, to revise any systems or processes or policies that exist in my organization that may be limiting or biased against diverse family caregivers and diverse employees. And so I think it's time in our industry to really take a look at how can we do better. So I'm grateful that you are part of this conversation and excited to hear how these conversations and this learning impacts you all in the future. And there's plenty of research to support what I'm saying. We see that for example, in emergency room situations, African Americans, their pain management is denied. They're denied pain medications 41% of the time. For Hispanic and Latinos, that percentage is in the 30s. And then for white folks, it's much lower. Their pain is by and large well managed. People, it's like 20% that say my pain's not as well managed. So we see there's a lot of statistics and research out there that supports the need for us all to do better and work for equity in our health and aging systems. In African American and Black communities, caregivers report some or a great deal of difficulty with healthcare tasks such as medication management or caring for wounds. So 54% of these caregivers are having difficulty. And I think we all know that there is not enough training for caregivers, period, around how to manage the increased complexity of care that they have to provide. So I don't know about you, but I noticed that after the Affordable Care Act went into place and people were kind of getting moved out of the hospitals, moved through rehab much faster, that then you have people at home who are lay people who are handling wound care and wound vacs and dialysis at home and doing so much more complex medical care that even, myself as a trained as a CNA with 20 years experience behind me, I would need training on it. So I know the gap that the caregivers are experiencing when they're coming from those medical settings, just trying to do right by their loved one. 56% report some or a great deal of difficulty with coordinating or arranging for care. So again, that's us. There's something we're doing that is not affirming, not helpful, not easeful for African American and Black caregivers when they're trying to get the needs met for their loved ones. For lesbian, gay, bisexual, transgender, queer, questioning, plus communities, 23% of caregivers disagreed that healthcare providers know about the help they provide to care recipients. And again, I think about the ways that the systems we're a part of, how that bias exists. So for LGBTQ plus caregivers, this does not surprise me that 1 in 5 is not even identified as a support by healthcare providers because the language is different, right? If I ask an LGBT elder who could help you, who could support you when you get discharged from the hospital or when you get discharged from rehab, if they're dealing with depression, anxiety, stress, pain, confusion, they're not going to be able to tell me who's in their life. They may not feel like they have anybody. So it's important to ask those questions differently, to say things like, who do you spend time around? Who do you trust? What do you do with your time? So that you can get a sense for who else is in this person's environment that could be part of supporting their care. 63% reported some or a great deal of difficulty coordinating or arranging care services from, again, us. So you see that they're reporting even more difficulty. And some of that is because if a relationship isn't familial, it's not respected as much in our healthcare system. So, for example, I had a client a few years ago. She had overdosed on some medication. She went to the hospital and she was in kidney failure. She had power of attorney forms naming her best friend. She was in her 20s. Her best friend was also in their 20s. And the doctor said, no, we need to talk to your parents. This is a woman in her 20s that had gone to the lengths of getting her power of attorney in place, which only 1 in 3 Americans have done. And because it wasn't a family member and because she was young, the doctor said, no, we need to talk to your parent. So that's when they called me as an advocate to come in and say, no, you're going to respect this legal document because this is this person's choice. And we all have the right to choose who our loved one, who we want to make decisions for us. So again, bias that we're not aware of can be severely impacting the health and well-being of the people that come to us for support. So luckily that situation turned out okay. And she recovered from the kidney failure and she's doing just fine. But it just, sometimes we think this doesn't happen, right? In health and aging, we think, oh, everybody just wants to support and we treat every client equally. We're not treating people equally or equitably if we don't respect their wishes and if we don't understand the things that are important to them. More than a quarter of LGBT caregivers feel isolated due to caregiving, so they have less personal time, limited engagement, more isolation than any of the other groups. And LGBT older adults are more likely to be isolated than non-LGBT older adults. I'm going to ask you all to answer why that might be, why LGBT older adults may are more isolated than non-LGBT older adults. So I want to hear your thoughts in the chat as to why are older adults that are lesbian, gay, bisexual, transgender more isolated than folks that aren't. Almost 1 in 5 LGBT caregivers reports feeling symptoms of depression, sometimes or often in the past 4 weeks. So I'm going to pause and see what answers we got for why LGBT care. Oh, nobody answered? Come on, y'all. I'm not in an echo chamber here. I need to hear from you. So Beth said family of origin may not accept them, lack of inclusive practices by providers. Absolutely, those are some reasons, right? If you don't have a relationship with your family of origin, they might not be there for you in end of life. Issues with family. Other ideas, mental health and danger. We do see 2.5 times the rates of mental health issues in LGBTQ plus communities, and a lot of that is due to lack of support, stigma, discrimination, and violence. Okay. I'm seeing a lot of great ideas and recommendations. Sharon said they may still be in the closet due to stigma. Absolutely. 78% of LGBT seniors go back in the closet and they go into senior housing because they're afraid of how they're going to be treated by their peers. But the two primary reasons why LGBT older adults are more isolated is one, because they're 3 and 4 times less likely to have children. So there's not that safety net to check in to say, did you take your meds? Did you make that doctor's appointment? Or to be a companion? And also because of the HIV/AIDS crisis. So we have a whole generation right now that is aging that lost about 50% of their peers. And so that too contributes to extreme isolation and a lot of internalized trauma around, will I age? Do I feel okay that I got to this age and my friends didn't? What's different about me? So you have a whole generation, many of whom didn't think they would age, haven't planned for it, and aren't sure how to navigate these systems. So I'll get off that particular soapbox, but I appreciate everybody's engagement. Thank you for answering those questions. And Nina, if there's anything else you want to share, please chime right in.
Continue along, Jackie. This is great. And thanks so much, folks, for your participation.
Okay, so again, the impact of culture on the health of caregivers. When we're talking about American Indian and Alaska Native caregivers, we see many of the same concerns. Again, 1 in 5 disagree that healthcare providers know about the help they provide to their loved one. 40% report some or a great deal of difficulty with coordinating for care services. So you see, for this community, it's 40%. For LGBTQ folks, it was 63%. And for African American and Black caregivers, it's 56%. So all of this is higher than it should be, right? Connecting with us, coordinating with our services should be the easy part. But if on the other end of the phone, we don't have the presence, the cultural competency, the language access, or people of that identity working for our organizations, we miss the boat. 36% of American Indian and Alaska Native caregivers have some or a great deal of difficulty with healthcare tasks. So again, that training, that how do I learn this job of being a caregiver and do it right, is a concern in almost every one of these communities. On average, Chinese American caregivers agree that cultural obligation is a reason they provide care for their relative or friend. That concept of filial piety, of caring for elders and supporting them as they age, has deep roots in Asian American and Southeast Asian American communities. So you'll learn more about that in those webinars that'll be coming up. So stick around. 16.3% of Chinese American caregivers report some or a great deal of difficulty assisting with cultural tasks. Language barriers in Asian American and Southeast Asian American communities, that language concern is impacting care and impacting people's health and wellness. So the more that we as providers can get rid of those language barriers and improve access, the better these health outcomes are going to be. Again, you see cultural tasks, translating health related information, navigating legal issues about immigration and naturalization while trying to provide care. I cannot tell you, it still for me breaks my heart every time I get a call from a senior or their caregiver where the senior is not a citizen or doesn't have rights to Medicaid and to care because there is no safety net. There's no safety net. So those folks are at home. Their families are super stressed out, trying to do the best that they can. And they have not just the fear of losing their loved one, but also the fear of what's going to happen if the law comes after them. And it's just on a personal level, it's personally devastating to not have an answer or not have a pathway for folks who are in a really tough situation. Caregivers who report more difficulties performing cultural tasks have higher levels of that strain that we talked about. For Southeast Asian American caregivers, 1/3 report some or a great deal of difficulty with those cultural tasks as well. So if you have a Southeast Asian American caregiver, 1 in 3 is having difficulty communicating with you, communicating with the folks at your organization, with their medical providers, with any support services they need, translating what the doctor's saying or what the system is saying to their loved one so they can make an informed decision, and navigating, again, those legal issues. More than 1 in 4 Southeast Asian American caregivers agreed that caregiving had negative effects on their physical and emotional health. 22.7% agreed to feeling isolated due to caregiving. So, what's really exciting about the webinars that are coming up is that you get to deep dive on each of these communities. So, we're talking statistics right now, and I'll get into best practices. But in the other webinars, you're going to hear people's stories. You're going to hear from these communities saying, here's what's happening for me as a caregiver. Here's where I need support and why I care for my loved one so much. So there's some really great resources coming up that I hope you'll participate in. For Hispanic, Latinx, Latino communities, there is a lack of informal and formal supports, and this increases strain for caregivers. So 51% agree they're the only person to help care recipients. 31% agree that caregiving has negative effects on their physical and emotional health. And this typically looks like caregivers, neglecting their own needs, not sleeping, not eating right, not getting time for self care, not going to the doctor, not taking their own medications appropriately. And I think part of us having that aging happening in our country and thinking about that 54 as the average age of caregivers that responded to this survey, I've seen what it does to a caregiver who is 60, 70, taking care of somebody who's 80, 90, or 100. They want to be there, but the caregiving journey in some ways is lengthening due to good medical care. So even, for example, a condition that more heavily impacts Hispanic communities, Alzheimer's, that somebody can be caregiving for up to 20 years. So even if you started your caregiving journey at 50 and you're 70 by the time that caregiving journey is over, imagine what that does to your health to be providing that very physical, constant social support for your loved one. And 30% report feeling more isolated due to caregiving. In the focus groups, one of the caregivers from Silver Springs shared, having my parents with me and having the opportunity to take care of them is gratifying and valuable. I do it with great honor. And I think that's the piece that, for myself as a provider, I always try to center. So we're going to talk about best practices, but really, with diverse family caregivers, it's about how do you see them and support them in a way that affirms who they are and the decisions they're making, right? So you as a provider may say, oh my gosh, you can't take care of your parent or your husband or your friends. You can't bring them into your house. It will harm you to do that care around the clock. That may be what's in your mind. But for the person in front of you, there is not another option. The family I was talking about, the Latina sisters, the one who's in her 60s, there was not a choice. She didn't even want her sister to go to rehab because she was concerned about how she would be treated or if she would get quality care. We had to have a lot of discussion to for her to even be okay with her sister doing that. There was not another option besides bringing her home. I had a young man who is one of three sons, and his mom had advanced diabetes. She was on dialysis. She had severe agitation, and he did not want to let her move into a skilled care facility, even though he didn't have the skills and there was no way he could have had the time with his job to provide that care. And there was no one else that was willing to. So these are deeply personal decisions. And oftentimes in our systems, we move too fast, right? We're like, make this decision. You're going to move here. You're going to do this. You're going to do that. But for diverse family caregivers, they need the time to understand what their options are, to understand what you're telling them, and to make informed decisions. So I'm going to be highlighting some of the best practices, but if you have questions, now is the time to ask because we got exactly 7 minutes left. So if you have questions, put them in the chat. Thank you so much for the folks that have contributed to the chat. And I appreciate, Kathy, your point that older people with lifelong disabilities, whether intellectual disability, mental health, or physical, are not always recognized and included on diversity discussions and more. Absolutely, that's true. Absolutely. So, folks, if you have questions, put them in the chat. If you have resources you want to share, put those in the chat too. Upcoming events that may be further learning for folks, anything you want to add to this conversation, your voice is welcome. So, let's highlight some of the best practices that you'll be learning more about in the weeks ahead. On an organizational level, training like this at your organization can make the difference. It really can, because we're not prepared to fully serve diverse families and diverse clients if we don't understand their needs. So, for example, at my organization, at the Care Plan, this year we have really focused on how to increase our competency with serving trans clients. And so I've had an outside facilitator come in and do 2 trainings. We've written a value statement around how we want to support trans clientele, gender expansive, non binary folks. We have folks on our team, so we've already done that work to hire and create an inclusive work environment. And we spent 3 additional sessions every week talking about what care management looks like for our trans clients. So, how do we support people through top surgery, which is a unique experience that many of our trans clients have or are seeking? How do we provide support in appointments to advocate so that doctors and nurses don't misgender our clients, don't require unnecessary testing, and treat them with the respect they deserve? How do we find trans competent resources and navigate asking those questions? So, on an organizational level, it's about internal culture and external services. So, that training is really important in setting the tone. Making sure that you have a non-discrimination policy that doesn't have 15 layers of dust on it, that includes sexual orientation, gender identity, and expression. That can be a great jumping off point to have these conversations, to just review the policy and say, how do we live into this? How do we prevent discrimination from happening in our organization? Where are our spots that we aren't seeing the needs that need to be met? And my favorite, hire from diverse communities. I can come in as a consultant. Nina can come in as a consultant. You can hire Diverse Elders Coalition as often as you want, but there is no substitute for hiring from the communities you're serving and nurturing and mentoring that leadership. It changes the way your organization works, it changes the way your services are received, and it opens up new opportunities. Develop caregiver training. You heard over and over again that people are struggling with navigating our services and understanding medications and wound care and the way that they should be providing support. So, if your organization has the capacity to do more caregiver training, it is so necessary. As an individual provider, you can develop caregiver support programs, provide culturally competent referrals and resources that are affordable and in language. So that might mean active advocacy, that it's your job to reach out and build new bridges. For example, one of our clients who is Asian American, he is losing English proficiency. And so when his family took him home from the hospital, we contacted every agency we could think of to get caregivers that speak his language, that understand his culture. Because when he wakes up in the morning and his brain is foggy, he's not going to be able to communicate if that person doesn't speak his language. Remember that limited English proficiency, it's important to have forms and the ability to communicate. So either having high quality interpretation services or again, hiring from community. So you have somebody that speaks the language that can help with translation. For creating those materials, fifth grade reading level or lower, avoid words of more than 2 syllables and include pictures to illustrate key content. Listen for understanding, right? I talked earlier about how we have systemic bias and racism that runs up and through our health and aging systems. And we're in a moment to reflect and to address that. Oftentimes, when we think about difference, as providers, we still think we need to have the answer. You don't need to understand or know or center yourself in someone else's experience. It's okay just to listen to what their needs are, reflect back what you heard, and try to match their priorities. Focus on one concept at a time and support caregiver decisions. Use culturally competent trained medical interpreters. Limited English proficiency patients are 27% more likely to be readmitted. So that gives you the numbers for what we're saying here. That if we miss the mark in communication, then that absolutely impacts those health outcomes. Assess and do cultural screening with caregivers to understand who the caregivers are, what their needs are, and how to better support them. And again, these are our key takeaways. Within these diverse communities, people are having their own experiences, unique experiences. They're living at the intersections, right? And there's not one story. So make sure that you're having an expansive view of who a diverse family caregiver is. Respect and embrace that strong cultural commitment to caring. We all in these systems have a lot to learn from diverse family caregivers. Understand the different cultures and identities because that can really impact those health outcomes. And don't be afraid to get started. You can get started today. You have some learning under your belt, and you'll be seeing Nina in the weeks ahead to further your knowledge base. So I'm gonna pause and pass it on over to Antron.
Awesome, awesome, awesome. Thank you so much, Jackie and Nina, for the presentation today. You really laid out the groundwork for the next couple of weeks, and really the focus that we're going to be bringing to about for our family caregivers. In the chat, actually posting a handful of links for you. There's a link for the remainder events in the series. As has been mentioned a number of times, LGBTQ plus will be taking place in a week, followed by, I believe it's, what's the next one? You'll see the list. I'll leave it at that. If you're interested in actually joining the group, myself, James, and Samantha, there's also a link there to join the committee. So you can help us bring folks like Nina and Jackie here, so that we're getting the proper information to you all and the people in the community, so that we're having a diversity lens in all the work that we're doing. Additionally, as you know, AARP, we are an advocacy organization, and we're constantly advocating for our caregivers. So to keep up to date on the work that we're doing in the advocacy space, there's a link there. As well as if you're looking for resources in general, just for caregivers, there's a wealth of information and free downloadable or request by mail documents that can be sent to you. And with that, I want to say thank you again to Nina and Jackie for joining us today. And we really look forward to the future presentations. And I want to thank you all for joining us as well, and participating and providing your input in the comments. I think it's helpful for all of us to hear and really better develop what we're seeing in our communities, and how we can address those concerns or needs. So with that, thank you all, and I hope you have a wonderful afternoon, and we'll see you, hopefully see you in a couple weeks. Thank you.